You may have used these in the winter sales, and they're also a part of a world famous wrestling move, the elbows. There are a number of things that can go wrong with the elbows. In order to understand these pathologies and injuries, we need to know the anatomy. We'll cover the bones, ligaments, muscles, nerves, and other vessels to delve into the mysterious world of the elbow. So let's get started. So the bones, their main functions: provide a rigid frame, protection, blood production, and muscle attachments. The elbow is made up of 3 bones: the humerus, the ulna, and the radius, all of which are long bones. Most long bones have 3 to 4 main structures: the diaphysis, the main shaft, the metaphysis, the bit just before the end, and the epiphysis, the end. You can also have the apophysis. These are normal bony outgrowths that allow muscle attachments. So the humerus, for example, has 2 epicondyles. Now it's important to know that the bones take a while to form and fuse. These changes can happen from the ages of 1 to 13, and in some boys until the age of 16. So when looking at x-rays or scans, the olecranon, the sharp bit, can be mistaken as a fracture. Oops. As mentioned earlier, the humerus has 2 epicondyles. These allow muscle and capsular attachments. They are common sites of irritation. Now, the radius is like a shallow cup. It sits within the ulna and articulates with the humerus. It has a roughening here, known as the radial tuberosity. The ulna also has the tuberosity of ulna, also the coronoid process. Within here is a small notch for the radial head to allow it to sit comfortably and move comfortably within the joint. All tuberosities and the coronoid process allow muscle attachments. All articulating ends of the bones are covered in hyaline or articular cartilage. It is tough but smooth at the same time. Its main functions: protection of the ends of the bones, lubrication when moving, shock absorbance, and congruence of the joints. The elbow joint is complex, and it's made up of 2 different joints: the humeral radial ulnar joint, which allows this hinge-like movement of flexion and extension, and the proximal radial ulnar joint, which allows pronation, palm to the floor, and supination, palm to the sky. Now, on an extra note, the alignment of the bones create an angle at the elbow, also known as the carrying angle. To determine this, you draw a line down the middle of the humeral shaft and a line up the middle of the forearm, and where they intersect, that's where you determine the angle. The normal degrees is usually between 5 and 15. A larger carrying angle is referred to as cubitus valgus. It's usually larger in shorter people and women, and can also be larger in athletes that complete a lot of overhead throwing movements. And then a decreased angle, also known as gunstock deformity, is usually caused by malaligned fractures. Now, the joint itself is covered in a synovial membrane. It encapsulates the whole joint. When moved, it secretes synovial fluid. Its main functions to lubricate the joint, and it also carries nutrients and oxygen to replenish the chondrocytes. So, if you don't use it, you lose it. The next layer is the fibrous capsule. It has thickenings either side, known as the medial collateral ligament and the lateral collateral ligament. The medial collateral ligament is made up of 3 different features: the anterior band, the strongest and most important with stabilizing in rotatory forces and a valgus stretch, the posterior band, and the oblique band. Then the lateral collateral ligament on the radial side, shaped like a fan from the epicondyle, spreading out into the 3rd ligament, the annular ligament. It wraps around the radial head. Underneath it, there's also a protrusion of the synovial membrane. Both the annular ligament and the synovial membrane allow stability and comfort with the movement of the radial head within the joint. Now, to find out about the muscles, click here or in the link in the description. If you found this video helpful, give it a thumbs up and comment below.